Welcome. I'm Annamaria Ferrero from the University of Torino, and I'm going to present the best of the year 2025 for the medical treatment of endometrial cancer. During the ESGO Congress at the beginning of 2025, we had the first public presentation of the ESGO guidelines in the management of patients with endometrial cancer. Those guidelines defined risk groups as low, intermediate, high intermediate, and high risk group according to the FIGO 2023 staging and the molecular classification. Also, estrogen receptor were included based on the prognostic significance of estrogen receptor status in non-specified molecular subgroup. Adjuvant therapy was recommended in all the risk group, going from no treatment to the inclusion of checkpoint inhibitors. In advanced disease, also endocrine therapy was an option in low-grade estrogen receptor positive tumors, and immunotherapy was considered in advanced and recurrent disease, both in the first and in the second line treatment. These recommendations were based on the results of medical trials in checkpoint inhibitor that were presented in 2024 and then updated in 2025 and presented at the most important congresses on gynecological oncology in 2025. Starting from the Ruby trial at ESGO 2025, the time course of adverse event was presented, showing that treatment-related adverse events generally occur within the first 6 months of treatment, especially during the chemotherapy administration. And also the immuno-related adverse events were very low in frequency. 2 posters that were presented at ASCO 2025 showed no detrimental effect of dostarlimab on quality of life, and also confirmed the benefit of dostarlimab in this group of patients, also in terms of time to subsequent first and second treatment. DuoE trial, it was presented also at the ESGO 2025, focusing on the patient-reported outcomes. The AOTC questionnaires were assessed, showing a reduced risk of deterioration in physical and role functioning in the MMR population treated with durvalumab, and also in the pMMR population treated with durvalumab and olaparib. Again, concerning the DuoE trial, we had also another important presentation at ESGO 2025 focusing on the biomarkers. We know that biomarkers are an important topic, especially in the pMMR population. And in this subgroup of population in the DuoE trial, the prevalence of biomarker was very high, with also high frequency of overlap between biomarkers. And the benefit of, in terms of progression-free survival, survival was confirmed in all the subgroup according to biomarker or histology in the PMMR population treated with durvalumab and olaparib. A poster presented at ESMO 2025 showed also a clinical benefit in terms of progression-free survival in patients with a high tumor mutational burden, consistent with the analyses that were performed in the dMMR population. The ATTEND trial on atezolizumab was presented at ESMO 2025, focusing on the final overall survival results. The overall survival was not improved in the whole population, but there was an improvement in the dMMR population. This improvement was not confirmed in the Asian population as for the progression-free survival. About the ATTEND trial, also the aneuploidy was explored and presented at ESMO 2025. 9% of the dMMR tumor are aneuploid, and aneuploidy is associated with the worst progression-free and overall survival. Also, the ENGOT N11 trial was presented at ESGO 2025, focusing on the exploratory analysis of disease-specific survival. This trial addressed the role of pembrolizumab as in the adjuvant setting, and the disease-specific free survival was not improved in the PMMR population, but demonstrated a substantial improvement in the dMMR population as for the progression-free survival. The SIENDO trial was presented at ESGO 2025, confirming the long-term benefit in terms of progression-free survival for the subgroup of patients with P53 wild type. This was especially in the PMMR population, and support the ongoing trial that is going to include only PMMR wild type, P53 wild type patient. At IGCS 2025, also the benefit in terms of the first and the second subsequent treatment and the progression-free survival too was presented for the patient with P53 wild type. At ASCO 2025, also endocrine therapy was presented. This was a phase 2 study of the combination for abemaciclib and metformin in estrogen receptor positive recurrent endometrial cancer. The rationale of this trial was based on the activation of PI3K pathway by the combined administration of aromatase and CDK4/6 inhibition, with metformin inhibiting the PI3K pathway. So in this phase 2 trial, an overall response rate of 32% was presented, with a progression-free survival of at least 19 months. The role of trastuzumab deruxtecan in HER2 positive patient is well known, and this is one of the target of ADC that represent the future for endometrial cancer. The targets are several. We have HER2, folate receptor, TROP2, and also also B7H4. All these targets are being addressed in ongoing trial with antibody-drug conjugates against these targets. And so what can we conclude? Which are the news in 2025? Surely we had the ESGO guidelines for the management of endometrial cancer. Estrogen receptor has been included in the subgroup of non-specified molecular profile, and the endocrine therapy is considered an option in low-grade estrogen receptor positive advanced disease. And especially the role of immunocheckpoint inhibitor has been confirmed, particularly for the dMMR population. Which is what is coming in 2026. We have seen that P53 status may represent a predictive marker for selinexor efficacy, and the phase 3 trial is ongoing. ADC have exciting potential in endometrial cancer, and the biomarkers and the right sequences will be crucial for the future. Thank you for your attention.